Hey guys, we're doing cancer overview today.
So, the history of cancer. In 1775, Pott noticed a relationship between chimney sweeps and squamous cell carcinoma of the scrotum due to their exposure to chimney soot. And this was the first incidence that cancer was linked to external exposures. In 1903, Goldberg in London used radium to treat basal cell carcinoma of two patients successfully. In 1950, Winder and Graham and Dahl found a relationship between cigarette smoking and lung cancer. And during the late 1900s, scientists began to look at the specific genes that were being mutated to cause cancer and started cloning genes that suppressed the cancer by targeting those genes that were commonly mutated. Some trends. Cancer is more likely in older age because the cells are older, they've had more time to mutate, and you're more likely to get cancer with this age increase. And with the average age increasing overall, we're seeing an increase in diseases like cancer. Lifestyle and other environmental factors are linked to cancer. Lung cancer is currently the leading type of cancer for both males and females. And we have seen the prevalence of lung cancer drop drastically over the past 20 years as the prevalence of smoking decreases. There are numerous other external factors that can lead to cancer, like Potts found back in 1775. Some of the defining features of cancer cells, they have large nuclei with various shapes. They're quickly dividing cells that are very disorganized. They have a variation of shape and size of the entire cell, and eventually they lead to tissue invasion and metastasis.
So there are several different ways to assess for whether or not you have cancer, and a lot of them are screening tools that are specific to the type of cancer. And these assessments are either performed on a regular basis as a self-exam or by your physician. So the first one, these three are the most common ones that are performed. For colon cancer, a colonoscopy will be performed by a gastroenterologist, and it's typically done under moderate sedation. And if you're at average risk, you'll start getting these at age 50 and then every 10 years after that. And then the second one is breast cancer, and you can either screen for that with palpation or a mammogram. And for palpation, you should thoroughly check each breast for lumps, swelling, or distortions, and see a physician if any of those are detected. And a mammogram is an x-ray of the breast to check for masses. And if you're at average risk, between the age 40 and 44, you have a choice if you want to start screening for them. And between 45 and 54, you get one every year. And after the age of 55, you would get one every 2 years. And the third one is a screening for cervical cancer, which is a pap smear. And that will be done by your primary care physician or gynecologist, and they will swab for abnormal cells in the cervix. And if you're at average risk, you will get one of those every 3 years, starting at the age of 21 up until the age of 65.
I was muted. So some common signs and symptoms just for like the general variety, like wide variety of cancers, is bladder and bowel changes, fatigue, bleeding, bruising, like for unknown reasons, like you have no idea why that is happening, persistent cough, pain after eating, nausea and vomiting, fever again, like for an unknown reason, weight gain or loss that you're not trying to do, new changing, moles, lumps or nodules in your breast, armpits, and even stomach area, unhealing sores and wounds, jaundice, vision changes, and headaches. And like I said before, there is a wide variety of symptoms, and you might not experience these all with one certain type of cancer or the other, but just know that these are general symptoms. And then cancer has, it's determined through stages, and the most common staging system is the TNM, and it's the T stands for size and extent of the primary tumor or the main tumor that's being looked at. So I gave examples below, but TX, the main tumor, can't be measured. TO, the main tumor, can't be found. And then T with a corresponding number refers to the size and the extent of the main tumor. And then, like, the higher the number, the more severe or larger the tumor is. So, like I said, T1 would be a better outcome than T5. And then N of the TNM scale would be the number of nearby lymph nodes that are also cancerous or infected. And again, the grading is the same way. And then N with the number responding after it is refers to the number and location of the nearby lymph with it. Same thing, the higher the number, the more lymph nodes. And then M is if the cancer has metastasized or not. And so MX, the metastasis can't be measured. So like for some reason they can't get in there, they can't see it all. MO, cancer hasn't spread to any other part of the body. And then M1, cancer has spread to other parts of the body. So, and then, like, you would see either T with a number, and then N with the number, and then M with the number after it all together. And then typical medical treatment. So just like cancer varies, so does the treatment based on what cancer you have, what's present, what's going to be best for you. But there's a whole bunch of different options you can have for cancer treatments. One being surgery, so you just go in and they remove the tumor or cancer from your body. You see the best results when you have solid tumors and they're contained in one area, therefore you can just go in and take it out. Cryosurgery, lasers, and hypothermia are also treatment options for surgery. So it's like high heat to small areas or cold heat to small areas to kill the cells. And then radiation, there's two types, external and internal. So external, the radiation beam comes from the big machine outside of your body. And this is for local treatments, specific part, like for a specific part of your body. And then internal is the source of radiation is put inside your body. And again, it's like a local treatment, but it's like inside your body, like taken through a pill or anything like other thing like that. Chemo, so chemotherapy is a use of drugs to kill the cancer cells, and they can be administered orally, intravenous injection, into peritoneal, into arterial, or topical. So there's a whole bunch of chemo treatments available. Immunotherapy, so that helps your immune system fight the cancer itself. So they take different types of substances from living organisms and then put them in your body, and that should help your immune system fight them. And things such as immune checkpoint inhibitors, T-cell transfer therapy, monoclonal antibodies, and immune system modulators. So continuing with treatment, there's target therapy, which targets the proteins that control how cells grow and divide. It's small molecule drugs, monoclonal antibodies. And then hormone therapy, it slows or stops the growth of cancer that uses hormones. And then the two categories are one that blocks the ability to produce hormones, and then two, the ones that interfere with the hormones and how they behave in the body. And then stem cell transplant. It's a procedure that restores blood-forming stem cells in people whose are destroyed due to high doses of chemo or radiation. So this is often seen after they have radiation or chemo treatment, and they do stem cell transplant to restore what they have lost. And then precision medicine is really new, and it's also called personalized medicine, and it's not really seen a lot right now. And this is because there's a lot of research on like going and but the hope is to have the treatments completely tailored to the individual and the changes in their cancer, because normal treatments right now are just due to what kind of cancer you have, what are the symptoms that you're having, and how this is different than personalized medicine is yours is based off of your symptoms and stuff right now and how it relates to other people that have also had the same symptoms. So now they're trying to make it so more specific for you because everybody heals differently.
Okay, to elaborate a little more about chemotherapy and drugs. So chemo drugs target cells at the different phases of the cell cycle. So understanding how these drugs work help the doctors to predict which drugs are likely to work well with the cancer. And doctors can plan how often these doses of the drugs should be given based on the timing of the cell phases. So doctors need to understand how all of these medications work and where they affect the replication of DNA in order to best target the cancer. Alkylating agents damage the cell's DNA to keep them from reproducing. So nitrosoureas are a special form of this alkylating agent that can cross the blood-brain barrier and treat tumors in the brain. Antimetabolites interrupt the cell production by substituting themselves for the building blocks of DNA and RNA. Anti-tumor antibiotics change the DNA inside the cancer cells to keep them from growing and reproducing. So anthracyclines are a form of this, and these affect the enzymes that are needed to copy DNA and bind to the DNA to stop the reproduction of the cells. Some side effects of chemo treatment are due to this form of treatment damaging cancer cells along with the healthy cells, so they're not targeted specifically for the cancer cells. So the patients could feel fatigue, they could experience hair loss, easy bruising or bleeding, infections, anemia, nausea and vomiting, and appetite changes. And there's a lot more side effects depending on which type of chemo treatment that they're using. And some other medication therapies, like Tamara mentioned, targeted therapies identify receptors that are on the cancer cells and attack only the cancer cells. So this treatment spares the healthy cells, and this can be used to treat cancer, or it can be taken as a preventative following cancer remission. Hormone therapy, this works to starve the cancer from the hormone supplying it by preventing the body from making the hormone or preventing the cancer from being able to use the hormone. So usually this is used to treat cancers that strive on sex hormones. So this would be certain breast cancers, prostate, uterine cancers, and other cancers related to the reproductive system. And immunotherapy utilizes drugs to boost or alter the immune system to recognize and attack the cancer cells.
So I had the pathophysiology and cell dysfunction of cancer cells. So just to start off, cancer cells stem from either genetics, exposure to toxins, radiation, UV exposure, diet, and there are hundreds of other things that can lead to cancer, but those are some of the main ones. And then at the cellular level, some cells secrete their own growth factor that then attaches to the receptors on the cell membrane, on their own cell membrane, which is called autocrine stimulation. Other cells have mutations in genes coding for the receptors, and when too many of the copies of the gene are produced. This is called gene amplification, which leads to excessive production of the receptors. The increased receptors increases the tumor cell's chance to be triggered into a growth phase. Overexpression of the receptors or structural changes in receptors can lead to ligand-independent signaling, which means they don't need the ligands to attach to the receptors to stimulate the signaling. So all of these factors lead to increased proliferation in cells, which means they're dividing pretty fast. And then just continuing that, the cells are proliferating and they're also not regulated because the checkpoints that are present in a normal cell cycle are not functioning properly, so it's not getting stopped in its cell cycle if it's not like copied its DNA perfectly, which leads to cells that are dysfunctional. And these cells usually can't communicate with other cells, carry out normal cell functions, anchor themselves, so they're more likely to travel throughout the body through the blood and the lymph. And sometimes these cells have the ability to secrete their own growth factors, which I said earlier, but this actually causes blood vessels to grow towards the cancer cells, which feeds the cancer cells, but also takes nutrition away from other healthy cells. And then looking more at the tissues, the cells continue to grow unregulated And in most cases, they call it like a mass of cells that is a tumor. There's two types of tumors: benign tumor, which is a tumor that stays confined to the area. It's less dangerous, but there are some cases, like a brain benign tumor can add pressure to your brain, which can be really bad. And then there's malignant tumors that the cells from the tumor end up leaving the original tumor and travel throughout the body through the blood and the lymph, and they continue to replicate and oftentimes create more tumors in different parts of the body, and a malignant tumor is cancer. So the cancerous tumors often negatively affect the invaded tissue's ability to function. They do this in two big ways. The first way is the blood vessel formation that the cancer tumor takes from the rest of the tissues. So through angiogenesis, which is new blood vessel formation. And then it also, you can see in this picture over here, affects the normal functioning because it takes up space in the organ or the tissues that usually would be functioning properly, but there's a tumor there instead.
So cancer cells can have a lot of impact on different systems. And so some of the main systems, starting with the circulatory system, cancers can affect the number of blood cells that are circulating in the blood. And if a cancer cells gets into the bloodstream, they can metastasize to other areas of the body. And this is how cancer typically spreads, and it can also spread through the lymphatic system. And the function of the lymphatic system is that it usually traps and kills cancer cells and other kind of infectious agents, but sometimes the cancer cells can get trapped and grow inside the lymph nodes. And the endocrine system can also be impacted. Cancer and cancer treatments can alter hormone levels. Some cancer cells are able to produce hormones themselves, and this is known as paraneoplastic syndrome. And some cancer treatments are hormone therapies, as was mentioned before, and they tend to lower the levels of a particular hormone to reduce the chance of a cancer coming back or to starve it from its feeding source. And they can usually take this after other treatments to prevent cancer. And one way you can treat thyroid cancer, you can treat thyroid cancer by removing the thyroid itself, but this results in the inability of the body to produce thyroid hormones, and so you have to take a medication to replace them. And the immune system can also be affected. Cancer and cancer treatments often weaken the immune system, and certain cancer treatments usually cause a drop in white blood cells, resulting in a weakened immune system. And some of the treatments that can do this are chemotherapy, targeted cancer drugs, radiotherapy, and high-dose steroids. And lastly, you can experience referred pain from the mass of the tumor itself. And referred pain is pain that starts in one area of the body, but it's experienced elsewhere. And it's a result of interconnecting sensory nerves that supply different tissues. And so one example is that lung cancer can cause shoulder pain, and the image here is just showing different areas that pain can be referred to.
So to summarize, cancer cells are large, they vary in shape and size, and they uncontrollably divide due to mutations or damage to the cells. Eventually, this proliferation of cancer cells leads to tumor formations that can be classified as benign or malignant. There are strong, well-supported links between environmental factors and lifestyle factors and certain cancers. So for example, lung cancer and smoking. Cancer can affect any cells in the body that can divide, so all cells except for the majority of the nervous system. And due to this huge variety of different cancers, there are many specific screening tools, different signs and symptoms, and specific medications for each type of cancer. The severity of cancer can be classified by T, the size and extent of the main tumor, and the number of lymph nodes close to the tumor that have been invaded, and M, if the cancer has metastasized or not. Cancer can affect other symptoms in our bodies and even refer pain to other areas of the body. And there are numerous treatment options, including surgery, radiation, stem cell transplant, and there's also many different forms of medication, including the precision treatment, chemotherapy, target therapy, hormone therapy, and immunotherapy.
And there are references.